I think one of the things that came about from the meeting, besides trying to make it more widely used, was really trying to hone in on the protocols themselves. Mm-hmm. I think one of the aims that we would like to be able to do is really to have, the Magnums, the CMSC, and we had representatives from the North American Imaging MS group really have an international set of commonly agreed to MRI protocols, which are very similar in terms of what is the sequences to be used, the slice thickness, the details of it. And it was nice to have the vendors there because we're looking to see whether we can get their help in terms of having these available on their scanners so that it can become easily available. We had a lot of discussion about standardization for optimization, and very often people think about standardized scans as being inferior scans, but it's in fact the opposite, because you can optimize a standardized examination and you can do it well, and by having that optimized standardized examination, you're actually providing optimal care rather than substandard care. So I think it's very important to make that distinction, and I think there will be a lot of work in terms of trying to make that possible.
Yeah, you warned me about the work.
Yes.
But I think having the international presence and having people from different groups come together and agree upon what are the bare minimum core sequences, or how do we follow people over time, even though it's going to be a little bit dynamic based on where you are in the world. I think that's going to help push things forward. I mean, that's the McDonald criteria, right? When those are changed over time, it's an international presence of experts.
And we come from different healthcare styles, Europe, Canada, United States, yet we all have very similar fundamental goals of getting good quality imaging and using resources in a reasonable way, in an effective way. And so it's really interesting at these meetings how we come together to roughly the same place in terms of what we think we need and how we can achieve that.
And I think one of the things that we talked about earlier as well is that within our guidelines right now, we have sort of specific things to do with the MR and the specific things about how the MR should be used in a clinical setting. I think one of the things that we can work on in terms of making it common and similar is really the details of that MRI protocol. The clinical indications and how the MR is to be used will vary regions to regions and countries to country and district to district, because there will be local differences in practice and how drugs may or may not be available or how frequently they are available. But the core way of scanning the patient could be, in fact, very common and similar between all regions. And I think that would really help solve a lot of issues about people moving or having new scanners and all the difficulties that we have from that.
Yeah, panels like this where you could target specific healthcare professionals, such as the technician, such as the radiologist, I think would be extremely important as an international effort. And maybe it'd have to be in different languages. We were talking earlier about some language barriers.